Let you get back to work. Meanwhile, CBS 46's vaccine team extends beyond our local team of reporters. CBS News medical expert Dr. David Agus is joining us today via Zoom, lending his expertise. And Dr. Agus, we thank you for your time this afternoon. And one of the big questions for women that are concerned about having children in the future, are there any issues around fertility related to women getting the vaccine?
There's a lot on the internet about the vaccines affecting fertility, and it is all wrong. There is zero evidence that it affects fertility at all. In fact, it's been looked at very closely. It does not affect fertility. And pregnant women, there have been over 20,000 pregnant women who have been vaccinated, and they've all had a good outcome. So we are saying if you're a pregnant woman and you're high risk, you should get the vaccine.
And Dr. Agus, of course, we've heard that those who are most at risk are people with comorbidities or underlying health conditions. And a lot of times those folks are on medications to treat those conditions. Have we learned anything about medicines that may interact negatively with the coronavirus vaccine?
Yeah, it's interesting. This is the first vaccine or drug in America where the day it's approved, we'd only stop collecting data. With this, when you're vaccinated, you get a card and you get a QR code where you click it and you tell how you feel afterwards and the side effects you have. What we do know is that the one class of drugs that are worrisome are steroids, prednisone and drugs like that, because they block the immune system and they can block you from making a good immune response to the vaccine. There aren't other class of drugs besides immune suppressive drugs that are contraindicated now with the vaccine. That's the good thing. There's no contraindication with other drugs.
Dr. Agus, what about those who have already gotten COVID and are interested now in getting the coronavirus vaccine? Those people, do they need one dose of the shot? Do they need two, or do they need to skip it altogether?
So there was a study out recently with very small numbers showing that they made a good immune response after having COVID. What we're saying now is that we'd like you to wait 90 days from being exposed to COVID. And the reason for that is that you have at least 3 months of immunity from being exposed to the virus, and those vaccines are needed more by other people. But everybody who had the virus needs to get the vaccine, period, and they need 2 shots. There is no real data that 1 shot is enough. So they need both shots and they need to get it. When you make an immune response to COVID, if you have the virus, only a fraction of the antibodies and T cells actually target the spike protein, or what we call neutralizing. When you get the vaccines, 100% of them do. So it is much, much more protective to get the vaccine than the virus and lasts much longer. And it's critical, especially with the new variants, that everybody gets vaccinated.
Dr. Agus, last question real fast. A lot of seniors who have now gotten both of their shots, they want to see their grandchildren and they want to know when they can reunite with their family members. When is it safe, especially if those grandchildren or family members have not themselves gotten the vaccine?
What we know is that the vaccine probably protects around 70%. So about 30% of people can have the virus and potentially transmit it to others. And about 5-10% can be symptomatic from the virus. So if you have the vaccine, what that does is it blocks you from being hospitalized, it blocks you from dying from the virus. And that is remarkably powerful. But it does not give you a free pass to go without a mask and to not socially distance. We need to vaccinate and then continue to wear a mask and socially distance, and the virus numbers will go down. We've seen that in Israel, right? They've vaccinated everybody over 65, and there are almost no hospitalizations or serious illnesses in that population. That is great, but it is not a free pass to go and hang out with people who have not been vaccinated or to not wear a mask or socially distance.
That's a perfect note to end this on. If you get the vaccine, it is not a free pass. CBS News medical expert Dr. Agus, we thank you so much for your insight and your time. Have a great afternoon.